Okay, well, hi everyone. My name's Gabby Miosa. I'm a current P4 student at the University of Rhode Island. I'm last year's SSHP president, and I'll be moderating this panel today. As I mentioned earlier, please feel free to, keep yourself muted and cameras off. Throughout the panel, if you have any questions, that's when you can feel free to put them in the chat, or at the end, we should have about 10 to 15 minutes if you'd like to unmute and ask any questions for our panelists. So we have a really amazing group of pharmacy alumni here today who have donated their time, and they've all done a lot of different things throughout their career. So I'm excited to have them all introduce themselves and explain, what position they're currently in. So anyone who'd like to start.
I guess I'll go first. Hi, everyone. I'm Alyssa Margraf. I graduated from URI in 2018. I did my PGY1 residency program with a community-based with Dr. LeMay. It's the URI Walgreens combined program. I always knew I wanted to go into outpatient ambulatory care, so I wanted to work directly with patients, and then I did a PGY2 at Rhode Island Hospital in ambulatory care. I stayed on with the specialty pharmacy where I am still today. And while I'm technically employed by the specialty pharmacy, I work more adjacent to them and now work directly in doctors' offices in patients that have gastrointestinal needs. So mainly focusing on inflammatory bowel disease. And most recently, I took on a position as the director of the PGY2 ambulatory care program.
Don't mind going next, Gabby.
Thank you.
My name is Mike, everyone. Mike Rickson. I graduated in 2018 with Alyssa as well. I wasn't sure if I wanted to do a residency or if I wanted to go into the pharmaceutical industry, which is working for a pharmaceutical company. For those of you that haven't heard of that side yet, I know I didn't hear of it until like the third year of pharmacy school, so it was very new to me. But I ended up getting what they call a fellowship, which is a kind of a residency of industry, basically. And I worked in an internal organization at Becton Dickinson, which was the company that makes like the pennials. They're a big sponsor of ASHP, so you usually see them pretty broad through there. I did a lot of things at BD, but then and a lot of things, it's very hard to say like exactly what I did because you kind of just support all the stuff on the back end that comes between like the research team and the team that kind of markets the product. So there's a lot of in between that goes on there, managing all the data and things like that. But then I transitioned to be a medical science liaison at Abbott Diabetes Care. So if you guys are familiar with the Freestyle Libre, the little device that measures glucose on the back of your arm, I used to educate providers and other healthcare providers on how to use that device. So I did that for about a year. And then I eventually transitioned into the role I have now, where I will manage a pool of funds that we give to groups to provide educational programming to healthcare providers. So when you get your pharmacy license, you'll eventually have to get CPE credit, and those CPE courses sometimes are funded by industry, and I am on the other side of that. So that's one part of my role. I also do a lot with our publications and manage a website too. So there's a lot going on behind the scenes with industry, and happy to answer any questions you guys have. But URI was great, made me very well equipped to get into a role in industry, and I really appreciate it. So thanks, guys.
I can go next.
Okay, yeah, go ahead.
Sorry, Caitlin.
Go for it.
Sorry, my name is Nicole Schwab. I graduated in 2019. I am not residency trained, but due to my privilege of being a URI graduate, I was very well rounded, and I kind of climbed the ladder and did a bunch of different things. I started in outpatient long-term care, community mental health. I transitioned into an inpatient role where I was doing internal medicine, critical care, transitions of care. And then my dream was always to work in ambulatory care. I also always felt like my passion was to be directly with patients as best as I can. So currently I am a pharmacist at the Cardiovascular Institute for Brown Health. I've worked for Lifespan for 7 years now, and it was just from a kind of a networking experience that I was able to end up in this role that I am in now. I'm an anticoagulation pharmacist, and I manage a roughly 2,500 patients who are both on different blood thinners, DOACs and warfarin. And I also work with a team of other pharmacists, and we manage a bunch of different care settings with regards to cardiovascular disease across the state. So I, due to my experiences and being adaptable and well-rounded, have gained a lot of different experiences. And if anyone wants to hear about kind of like a non-traditional trajectory of pharmacy, if you don't end up doing a residency, I'm happy to help.
I can go next. So my name's Caitlin. I actually graduated in 2014, and I actually wasn't set on residency until actually Dr. Estes's rotation. And she was like, I think residency might be kind of the path for you. And it kind of like opened my eyes to a whole new idea. I was set on being a community pharmacist, but actually I did my PGY1 and kind of learned all the things that I was interested in at Hartford Hospital. And then I have since come back to Hartford Hospital. I'm the critical care specialist. So I manage mostly, anything critical care related that kind of affects Hartford Hospital. So we have over 100 ICU beds. So I do a lot of policy development. I round in their MICU. I do things that kind of affect the Hartford healthcare as a system, which I never really thought that I would be doing. You asked me my years at URI, that would be my path. And so I am really grateful for the opportunity that I had, and my eyes were kind of open to residency, and where I've kind of landed, I'm pretty grateful as well. So yeah, that's me.
I can go next. So my name is Megan Lees. I graduated in 2021 from URI, and right after graduation, originally thought I wanted to pursue a residency in pediatrics and then eventually pediatric oncology. Didn't really work out in being my path, so I kind of had to change the trajectory a little bit. And I'm still in pediatrics. So after graduating, I accepted a PRN job, which means basically like an as needed or like a float pharmacist, and ended up moving to Cincinnati Children's Hospital. And in the time, they were expanding and building a whole new critical care building with a new pharmacy. So I stayed on, trained technically as a PRN pharmacist. And then after 3 months of training, a third shift position opened up. So I ended up accepting that. So I've been an overnight pharmacist for about 3 years now with them. And with that, we basically oversee inpatient all of our specialties and all of our patients, because all of the satellite pharmacies are not open overnight except for the ED pharmacy. So with that, I was able to be co-trained. So I do respond to code blues overnight in our regular acute care patients, and then all the way to all of our different ICU patients. And then currently I am finishing my project work on being promoted to a pharmacist 2. So with that, I'm like an operations specialist. So I oversee our operations in what the pharmacy does for our outpatient infusion clinic. So those are patients that are coming in that have like Crohn's disease or genetic disorders or any other like endocrine disorders, that we will prepare the infusions for them. And so I'm working on improving our services while patients are there and trying to cut down on their appointment.
I guess I'm up. Hi, everyone. My name is Joe. I graduated in 2021 with Megan, and I actually work right behind Alyssa on a day-to-day basis. So I graduated 2021, was very unsure about residency until I see her in here, so I can call her out. Dr. Charpentier said, Joe, I think it's for you. I then proceeded, because she's also in here, I can shout her out, pursue Dr. LeMay's community-based residency. So Alyssa and I are from the same residency family tree. I always knew I'd liked community from my time interning during school. After my PGY1 community-based residency, I accepted a role in the Lifespan or Brown University Health, now specialty pharmacy, where I was a staff bench pharmacist for about, I guess I would say, a year and a half. And it was actually this past February, March, I accepted a new role in pediatric pulmonology. So I work in an outpatient clinic setting, much like Alyssa. I got down into the clinic space with the providers in August after spending the summer training, shadowing, and developing my skills to support the providers in medication access, transitions of care, and also provide teaching for biologics. Didn't think I'd ever end up in pediatrics. If you had asked me as a student, I would have said, heck no, like kids are not for me. And now I can't imagine myself doing anything else. And if you were to ask me, I probably would say I also don't have my dream job yet. So there's plenty on the horizon. So excited to be here. And thank you, Gabby, Jennifer, and Dr. Estes for the invite today.
Thank you all so much for sharing. It sounds like you all do very different, amazing things. So I'd love to dive deeper into that and kind of hear what your day-to-day responsibilities are and give us, your day in the life kind of. I know every day can be a bit different, but just some of the things you do on a daily basis. Mike, do you want to start us off?
Yeah, it's actually a meme to ask somebody in industry what a day in their life is. So it's funny. Our days are always different. So we always do something different every day. But essentially, you know, a day in my life is I work from home. So I am consistently answering emails. We go to a lot of conferences, so I have to kind of give you like a day in the life of just a random day, basically. Um, I manage our grants, like I talked about initially. I managed our publications. I manage our fellows. So we have 2 fellows, um, as well as a website. So my day usually consists of me taking on small projects within each one of those tasks. So I could be having one-on-ones with my 2 fellows to talk about a project they're working on. I could be looking at a couple grants where somebody submitted to us a program to say, hey, we'd like to run an educational program, or let's just say you or I would like to have sensors for their students, which is a possibility for the faculty on the call. If you guys do want sensors for educational purposes, I would review that grant and decide if it's something that we would want to fund or provide devices for. Maybe someone on our team has a publication that they want to get submitted and they want to ask me about what journal it should go to, or if I have any other thoughts or recommendations, if I have a relationship with somebody. So there are a million different things I could be doing at any given time under those umbrellas. I manage those few aspects and I kind of take on whatever comes my way.
Awesome.
So
It sounds like you
hopefully that
have
was a decent answer, but it's a very hard question to answer, and it always makes it seem like people in industry aren't doing anything, but trust me, we are.
no, it
Mike,
definitely seems like there's a lot of things going on.
Mike, I'm gonna have to talk to you because as part of my day-to-day, I guess week to week, month to month, I actually precept the 2 PGY1 community-based residencies in Rhode Island, one at our specialty pharmacy and one with Dr. LeMay's program at a free clinic in Providence. And we definitely have a need for some diabetes education. So I will get your
I
email.
am more than happy to help you with that too.
And so I guess that translates to kind of, mimicking that. Our days to days are different. So for example, today, even though I'm a pediatric pulmonary, role, I covered the adult clinic. We have one day a week where our critical care and pulmonary fellows see patients in clinic. We have about 40 to 45 patients a day, anywhere from 4 to 6 fellows, which are advanced medical trainings for a fellow, for those of you who don't know. And it's a busy clinic. And so I was there for a half day. And then the other half of my day, I'm supporting it, both the pediatric and adult spaces, reaching out to patients for follow-up on med changes, initiating prior authorizations if needed. We have an entire team that supports certain clinics that actually completes prior authorization. So maybe connecting them to the problem at hand. During my day in clinic with the providers. So for example, yesterday I was with the provider all day. He saw 14 patients throughout the day. I was lucky enough to see a patient as he was kind of falling behind. So I just jumped in, evaluated the patient, saw how they were doing. I had previously talked to the mom about the cost of their inhaler, how they were doing on it, is something that they were willing to continue. Provided a vaccine to the kiddo, and so it's just kind of supporting the clinic in any way possible. Compared to Alyssa, I'm definitely in a newer space, a younger space, you could say. So my role is still in flux about where I can insert myself to support the needs of my providers. And I think that's an important part. If you're in a newer role, creating that for what your providers need.
Can kind of jump off of that. So Joe and I do a very similar job, just with like focuses on different disease states. So I focus mainly on our panel of patients that have inflammatory bowel disease. So that's namely Crohn's disease and ulcerative colitis. Um, and that I see pediatric patients a couple days a week. I have a panel of adult patients as well. And over the course of a week, I work with maybe 15 to 20 different doctors or mid-level practitioners and their panel of patients. I also sometimes see a little bit of hepatitis C. We work under a collaborative practice agreement, which is nice. So within my scope, I'm able to prescribe different biologic medications or other medications that are on our collaborative practice, as well as order any labs for routine monitoring, for safety measures. Depending on where I am on a day, it really depends on what we'll see. Patients are sometimes scheduled with me. It's nice I do have a schedule where typically kind of the way it works is a provider will do a colonoscopy on either a new patient or a patient that's already established in their clinic. They'll say, okay, this is a new case of Crohn's disease, or this is a patient that has Crohn's disease and their medication isn't working well for them right now. So we need to make a therapeutic change. So I'm going to have you meet with our GI pharmacist, and then they'll schedule an appointment with me, or sometimes it's a curbside consult where right after a doctor's visit, they'll just say, hey, Alyssa, can you come in and talk to this patient? Which I'm happy to do. And that's my clinic days. As a residency program director, I do have administrative time too. So I do have 1 day a week where it is work from home capable. And I'm making sure our 3 ambulatory care residents are have everything they need to feel supported and have a well-rounded experience so that they can go off and be independent pharmacists, clinical specialists, whatever that they want to do after residency.
That's great to hear the differences between your 2 clinics. Anyone else want to chime in?
I can chime in. I don't do anything like that. It's completely different because I work in an inpatient setting. So my day-to-day, I usually come in at 7, and then I usually pre-round on my patients. Usually there's some sort of issue that happened overnight. So I get kind of like a little handoff on what happened to my patients overnight. If any of the other staff rounding pharmacists have any questions about any of their patients, they usually ask me between the time that I'm going to be in my office. And then I pre-round from 7 to 8, and then I head down to my floor where I leave time for any of the nurses to ask me any of their questions before our formal round start at 8:30. I'm in a non-teaching unit, so I round with mid-level practitioners, the PAs, and APRNs with an attending nursing and respiratory, where we round on our 16-bed MICU. I also most days cover our 18-bed step down, which also has 2 medical ICU patients in it as well. And then so we round for usually 4 hours-ish. And then I am usually very tired and eat lunch. And then I catch up on, I usually have at least 1 or 2 meetings that I have to attend in the afternoon. And then I usually have at least 6 months out of the year where I'm precepting at least someone. So I have PGY1s, I have PGY2s and students that I take on rotation. So usually some of the time, either it's layered learning or it's, I just have 1 learner with me, where I spend some time with them in the afternoon. But my days can be pretty chaotic because if any need arises from any of my ICU beds or any of the ICU beds really in the hospital, if there's an issue that they are requesting an expensive medication or they're having an abnormal issue, that's when they kind of tap me in and I get involved in their care. But I think, Gabby, you spent some time.
I was just going to say that, yeah. I did get to spend a day.
My days can get pretty crazy.
Yes, yeah, I can attest to it. I was really lucky. I did my IPI at Hartford Hospital, and I got to spend a day with Caitlin in the MICU, and I think Colin was your resident at the time. And so there really was that layered learning aspect where I got to round with Colin, but then we went back and we regrouped with Caitlin, and I learned about vent settings, which I never even knew as a P2. So she's definitely very knowledgeable in things that you really learn on the job. So it's great to hear like how much further you can specialize and continue having lifelong learning. So it really was amazing being with you.
Oh yeah, no problem. I just also want to reiterate that I didn't do a PGY2. So I did end up in a job that, you know, for most the traditional sense would probably be PGY2 trained. And I did not do a PGY2. So you know, I know Nicole was talking about having a non-traditional path to where you want to be. And I think there's, you know, something to be said about doing things to make yourself stand out, or doing things you know, that would lend you into a nice position to add to your resume to kind of get yourself built up to where you want to be in your career. Nicole, I don't know if you have anything you want to add to that.
Absolutely. I for sure stand by that. One of my things I precept as well, and I tell everyone, you know, treat all of your internships and anything that you're interested in kind of as a job opportunity. Try to soak in and learn as much as you can. I found just with my experiences, being well-rounded and adaptable has really got me to where I am today. I know some of you have said the same thing, that you did not expect yourself to be in your current role. I never thought that I'd be monitoring and managing people's blood thinners or in the cardiology realm. I wanted to be a psychiatric pharmacist when I graduated. I ended up working in the ICU during COVID and managed vent settings and did all that as well at the Miriam Hospital. I did transitions of care. I did so many different things, and I found that I did value and like everything, and just felt that, you know, if you're open-minded and if you kind of put yourself out there and put your best foot forward, even if it's challenging or if it's something that you're not really sure of, if that's something that you want to do, definitely, you know, take the opportunity and try new things. And we might talk about this later, but one of the most valuable things for me was my internships, the IPPs and APPs. It kind of helped me navigate what I wanted to do, and then also, you know, set the bar for me to see what I'm capable of in the future. So I would just treat any opportunity, you know, like a job opportunity. Put yourself out there and see where you can land. Most of my current job, like on my resume, was because I re-networked with people I did IPPs and APPs with, or people from URI. So definitely use our community. If you stick it out and you do this program, it's amazing, and it definitely is rewarding on the other end. So yeah, I don't know if anyone else has to add to that.
I'll kind of add to that. So like Nicole, I didn't do a residency either. I thought that was what I wanted to do. This kind of touches on like something I wish I knew for graduating or something. One thing I will say, and I know Joe said it too, you do not need to accept your dream job right after graduating. Take whatever you can to be on the path. So like I knew I wanted to be in pharmacy, in pediatrics, and I took a risk and I moved halfway across the country for a PRN position. So I didn't even have a full-time position yet. I just kept my hopes up and was like, I'm just going to make all the connections I can while I'm there and train hard. And literally within training, they were like, do you want a full-time position? And, you know, pediatric oncology is still my dream, and it might just be a different path that I get there. So I'm still, you know, making connections, working in inpatient pharmacy, but we do have a satellite oncology pharmacy, and I keep showing my interest, and I keep reaching out to them, and they're like, okay, like, you're on the top of our list when we get a position that opens. Another thing I will say, my hospital's a little bit more stricter in the hierarchy of like PGY1, PGY2, like straight out of college kind of way. So if you have no residency training, you're a staff pharmacist in either inpatient or outpatient. PGY1 training, you can be what we call decentralized, which you do 50. Now it's kind of changed. It's like 80% rounding on patients in our acute care. And then 20% is staffing. And then 2 years of residency, you're able to be a clinical pharmacist where you're just strictly, you don't staff an inpatient pharmacy, you're strictly just rounding on patients. But a little bit of my day to day, so it's a little bit different than the other inpatient pharmacists. So working as a third shift pharmacist, my schedule is 7 days on, 7 days off. So my shift usually starts at 10, and then I usually get out anywhere from 7:30 a.m. to 8 a.m. And with that, We don't have any clin specs or decentralized pharmacists overnight. They're technically on call, but we're really relaying all of the answers. One of the biggest things I get is bank chops and what to do. As a staff pharmacist, we don't do pharmacokinetics, so I usually just try to do a quick gander if they're below or above. My first thing is, when is their next dose due? Because if it's due after rounds, I tell them just to hold off, speak to the clin spec that's actually following the patients. And then, like I said, I do go to codes at night, which it ends up that we have 4 pharmacists overnight and 4 technicians. I somehow always end up being the pharmacist that runs to the codes. And then I alternate every other night. I'm either verifying all of the orders coming in. I'm either checking all of we call unit dose, which are all of or tablets, capsules, anything taken by mouth, G-tube or anything. Or I'm with another pharmacist and we're checking all of our IV doses. And then we're kind of trying to, because sometimes there's downtime at night, we're trying to compound medications if we have a shortage. In pediatrics, we compound a lot of medications because, as you can imagine, our pediatric patients can't take a lot of things by mouth that we as adults can take. So you have to compound different suspensions and solutions. And then just right now with the shortages, we're just trying to mitigate. We try to help out day shift as much as we can so that they're successful during the day. And then it's not required of me, but I do still work a day shift on my off week just to kind of stay competent with the workflow and everything. So that I usually work a second shift from 2 to 10. And then in between all of this, I'm in the middle of working on, like I said, an infusion operations specialist. So sometimes I stay about an hour or 2 after my shift and I train the first shift pharmacist on how to look over infusion therapy plans.
That's amazing. Sounds like you have a very full week. Okay. I can't tell if my service is bad because I think everyone's frozen, but
You guys are frozen. I'll be back. You're good.
okay. I don't know if you could hear me at all, but I think there was
I
some
can.
freezing. Okay, great. So I just want to kick things off to the next question, since Megan kind of opened the door to, what advice would you give to yourself or any real pharmacy students? Looking back, what's something you think you've learned or things you might have done differently during school? And I know, Mike, you have to get going in a minute. So if you want to start this one as well, it'd be great.
Awesome. Thank you. I was just about to message you, so I appreciate it.
No worries.
Advice I would want to give myself. I
Or
would
any pharmacy
say,
students.
or any pharmacy student. Yeah, it doesn't have to be me. I would say, really going off of Nicole's statement, networking, really putting yourself out there. Networking doesn't mean schmoozing. It means just being yourself and being genuine and, building and developing relationships. It means a lot. And you becoming friends with more and more people, they have different ideas of things you could do. It's like education, having knowledge from multiple people in your network is powerful. So my advice to everyone is just to really put yourself out there. It can be scary for sure. I probably didn't do it enough in school. I didn't utilize the great team at URI as much as I should have. I definitely had a couple great relationships with some of our professors that I really value, and still I'm looking forward to seeing them at mid-year. I'm messaging them right now. So that would be my biggest piece of advice, is to really put yourself out there, like Nicole said, and try to network and build relationships. I like building relationships better as a term instead of networking. Sometimes networking has a bad connotation to it. It sounds like you have to schmooze somebody, but that's not the case. And don't let that be the case. You want to just really try to build friendships and relationships. So that's
Yeah,
my
I agree
biggest
with that.
piece of this.
Very well put. Same with what I said earlier about a job opportunity. Everyone's like, oh, I must, be super. I mean, I'm obviously always professional, but you want to be yourself. You don't want to be a walking resume. Everyone has different passions, even if they're not pharmacy related. And one thing that I also would recommend with networking is feel free to network outside of pharmacy as well. Some of the best part of my job is the relationships that I've made with the providers, the nurses, the social workers. And, it just helps when you get into a job. It makes your life so much easier when you have good relationships with everyone you're working with, whether they're a pharmacy technician or whether they're, a surgeon. So definitely, if you're interested in other disciplines as well, you know, don't hesitate to reach out. When I was in school, I was interested in community mental health and addiction medicine and public health as well. So I did a APPE internship with Dr. Jeff Bratberg and found so many different avenues for pharmacy as well. So as you probably have all heard, you know, you don't have like one straight path. You may branch out and end up in a completely different field than pharmacy. And I would start networking now and just follow what your gut instinct is and what your interests are, because it's your life, and your life doesn't have to be pharmacy. But you can have a valuable career if you just be yourself.
And your path will change, that's for sure. A lot. I'm sure that anyone on this call cannot remember all of our paths. And if you can, then you're probably doing very well for yourself. They're very different and very hard, and just trust yourself and trust the people around you. So I do have to head out, but thank you guys. I appreciate it. And it's nice to meet you on the panel, and hope everyone has a great night. So thanks, guys.
Thanks,
care,
Mike. Have a good one.
Mike.
I think what's important is, especially with like mid-year on the horizon, networking doesn't have to be these big events. It can just be between a grade or two above or below you. So for example, Alyssa and I now work side by side, and I'm always bouncing ideas off of her, like, hey, how do you do this in clinic now that you're in an established setting? Or chatting with other clinical specialists that have had clinics that have been around for 10 years. Or and Nicole, for example, is in the same health system. She has 2,500 patients. Like, how do you do that? And so networking goes beyond just going to events and these organizations. It's within pharmacy classes, neighbors, people like that you work nearby. And again, going outside of our specialty, I'm dressing up with the nursing team tomorrow as part of Halloween. So it's stuff like that help build camaraderie and expand your scope and knowledge base is to create a team environment.
Yeah, it's super important. In healthcare, you'll learn like you can't do it alone. It doesn't fall on one person. You need the team.
I want to highlight something else that Nicole said earlier too about doing something outside of pharmacy. I think that's really key to not just get so tunnel vision on like your schoolwork and everything you're doing right now, because pharmacy might not be your whole life. In fact, I hope it's not your whole life. It's really important to meet other people outside of pharmacy and even do things with people maybe you're in pharmacy school with, but something outside of it and outside of studying. Like, I think it also makes you stand out as a candidate if you're able to speak on something else where you learned a lesson from, or what makes you tick, or what you're passionate about, what gets you excited. Actually, Dr. Estes and I were really into yoga, and we did a yoga teaching certification class together. Was that my P3 year, P4 year? Now I can't remember, but that was really fun, and I thought it was so cool to do that with my professor too, and we got to do a yoga study together. So bringing pharmacy and something else we're passionate about all in one. So I think it's really, yeah, P3 year. Thank you. I think it's important not to get so focused on school, but like really enjoy your time and find something else that makes you happy at the end of the day.
Something that I did in college, I'm not sure if it's still offered, but I did an alternative spring break program. It was specific to community service. We did a bunch of different things. I did it a couple of years in a row. And it was something that I purposefully got myself into to kind of remove myself from the stress. Pharmacy school was very stressful, I'll be honest. It's very hard, very high expectations. And doing that community service and getting involved in something completely different really filled my cup. But as the years went on with that involvement, it actually like reinforced my purpose and why I became a pharmacist. And it was completely unrelated to healthcare. So I advise you, if especially you URI 101 students, if you're still here, get involved in different things, and it'll definitely help with the journey with pharmacy school.
That's all really great advice. Anyone else want to chime in on anything? If not, I can head on to the next question. I feel like you guys just loaded tons of advice on there, so I would have loved to have that as a freshman as well. So overall, it seems like I said, you all do very different jobs and have had, different paths to get there. With the current role that you're in, what's something you really love about your job and something, that other people might not know about your job?
I'll go. So, one of the things with my job, and I didn't really recognize it until I had some of my friends that had completed like their first or second year of residency, and then went off to smaller hospitals. So last year, my hospital ranked #1 children's hospital in the nation, and this year they didn't rank, but we were in the top 10, and we ranked in the top 10 specialties. So we see a lot of really rare things that on a day-to-day basis, like you wouldn't learn in pharmacy school. Or like I had friends, like I said, that left and went to smaller children's hospitals, and they're like, we don't even see that drug. Like we have drugs that are worth like $500,000 for a dose. So one of the things I really enjoy is like learning all of that. And one thing I will say is even when you graduate, you're never done learning. There is something I'm like looking up lexicomp and like clinical studies on like new things. Like I'll have doctors ask me about things, and I'm like, and especially with pediatrics, a lot of it is off label, or like we're just extrapolating like adult data. But I will say one of the things I really enjoy is like we're like the last option for a lot of children. And some of it can be really sad if you're like looking into like the actual patient and what they're there for itself. But to see like the success stories, like we've had patients that like had a 1% chance of survival and were in our hospital for like 10 months that they just got discharged. Um, and like knowing like, yeah, it's a huge like team of people, but like one of them, I went to their code twice when they were put on ECMO and they just got discharged home. So like some of that stuff, like even the little things, like answering simple questions for like the providers or like just getting their medication safely to them, like you have a huge role in like the care of those patients.
That sounds really amazing. I can imagine how rewarding it is to see your patients do so well.
My patients don't always do so well, being that I'm in the adult setting and younger patients tend to do better. So we see a lot of sometimes sad cases, but the success stories are sometimes what keeps you going. And I think from what I'm like most, proud of for my job is the relationships that I have built in my healthcare system and in my setting with the providers and nurses, and they really value almost too much. To be honest, I'm trying to set, careful boundaries with them. I were on a meeting today and they were like, well, how about we only discharge when Caitlin's around for pulmonary hypertension? And I was like, how about we don't? I love that you love that I'm around and I'm happy to help you. But like we can't base an entire discharge plan on what I'm doing. So I love the relationships I built. I love that the trust that they have in me. I love that, I really determine, therapy-based plans for a lot of the patients. I think that COVID helped us kind of bond as a team and as a hospital, and we've all kind of come out of that with like, we sink or swim together mentality. And I think that, I really value the team that I work with. Both the pharmacists and a lot of the physicians, nurses, PAs throughout. So that's what I love most about my job.
I feel like I can definitely piggyback off of the importance of boundary setting. That is something that I've had a very interesting time navigating as my years as a pharmacist. The clinic that I work at is a anticoagulation clinic where typically, primarily, we have a patient panel of patients who are on warfarin, which is a medication that requires very, very close lab monitoring. And it's more of an art than a science, they say, and you will learn someday why. But I also I'm kind of the catch-all point person for bleeding surgeries, catching patients with strokes and symptoms. And one of the things that I love most about being a pharmacist is like being that person for our patients. I have some patients that I call every week. I have built rapport with them over years. They tell me things about their families. It's very rewarding, but it can be a very challenging job, to make sure that, you know, you're triaging appropriate care. In my ambulatory care setting, I kind of am thrown a bunch of different questions that sometimes are out of my scope. And we have a very high volume clinic. So I'm constantly prioritizing. I'm constantly being as direct and clear with communication, with making sure things are getting addressed appropriately by the appropriate provider, making sure I can do everything with my due diligence. So it's a very rewarding job. It's something that's, I definitely value, but sometimes I've realized that I'm one of the only people that have like caught this error because of the frequency in which we follow up with our patients. So definitely making sure you're able to navigate utilizing your team while also maintaining appropriate boundaries. Because over the years, the cardiologists are like, Nicole, you're so helpful. Oh, can you help me with this random antibiotic that I need like for prophylaxis? And I'm like, I haven't thought about antibiotics in some time. So just being able to continue to have appropriate boundaries and help within your scope when it's appropriate is something that takes years to get used to sometimes. And you just want to use your support system, especially if you work with a team of other pharmacists and doctors as well.
I'm going to move away from patients for a little bit and just hype my team. I just love the people that I work with. We actually have like a soccer league where we play together once a week. So we've got a soccer game tomorrow. We're all going to wear Halloween costumes. Our inflammatory hub that we meet like once a month, sometimes they'll throw a like surprise in-person meeting. And this was July, I'm thinking back to, and I saw, oh, it's in person. And my partner, Erin, she just had a birthday over the weekend. So I'm going to bring in cupcakes and like use this as a reason to surprise her for her birthday. And then I show up to the hub meeting and they're all laughing because I brought cupcakes to my own, they threw me a surprise bridal shower. I was like, oh my gosh, like they're just so sweet like that. And we do stupid things like pumpkin decorating things and then like stockings around the holidays. And it's just like a really good group of people that we really all support one another and we have fun together. And like Joe said, like I can just turn around to him on like a Tuesday or Wednesday when we're in the same office and bounce ideas off of him. And we're just a really supportive team. And I think that's the reason I'm so happy in the job I am now, because I just really appreciate the people I work with and the diverse backgrounds that they bring.
I would add to that, but I think everything's been said. And I know we want to save time for questions from the audience, Gabby. So I want to be cognizant of that. But yeah, I mean, everything they all said, I can echo in some fashion.
I appreciate it. It seems like you all really love your jobs, and that really does come through. Okay, so now that we have about 15 minutes left, I do want to open up the floor to any questions from any students. You can feel free to put them in the chat or unmute. It could be about really anything we've discussed or anything we haven't discussed. And if not, I do have more questions, but we'll just give it a minute and see if anyone has any questions. Okay, well, I'm not seeing anything, so I'll just ask a couple more questions. Oh, spoke too soon. Let me see. Okay, this one is for Megan. Someone asked, what is it like working overnights? How is your sleep schedule? They were considering doing that later on in their career.
So I'm not gonna lie, sleep schedule was kind of hard in the beginning. But I was never a morning person. Even so getting to a first shift at 7:30 a.m. just wasn't my thing. And I do like the 7 days on, 7 days off. It's really nice. And I will say, if you're gonna do a third shift, I would really suggest considering it like right after college. One, because you're younger and your body can do it. But two, I really grew exponentially after my training being switched onto third shift because there's a lot of autonomy. And you kind of have to like problem solve yourself. And obviously, like I have 3 other pharmacists that I was able to like bounce questions from. And there was a learning curve in the beginning, especially because I was one of the COVID students. So, but I will say, like, I feel like even like going back and picking up a day shift here and there, I just feel like I learned so much more. So I think your nights you can adjust. It's hard, but I kind of push through. I will say I'm not social during the weeks that I work. It's strictly go home, sleep, wake up, go to work. But on my off weeks, it's like I can get everything done and I'm not like disrupted and like being like, oh, I have a day off, I have to get everything done. Like I have a whole week, which sometimes you procrastinate, but I enjoy it. But I don't know if it's gonna be like a forever thing for me, especially like in 10 years or whatever, once I have kids and stuff. But for now, my body's allowing me to do it. So I like it. Yep.
I've only done one overnight shift, and it was when I was working per diem with Walgreens. And like, kudos to y'all, because like I can't. Like, even one night was tough.
It's definitely not for the weak, but those people that are more night owls and not morning people like me, it definitely works out better.
Yeah, overnights definitely sound tough. So, proud of you for doing that. But my mom actually worked nights for 20 years, and I don't know how she raised me and worked 7 to 7. But I'll keep an eye on the chat and see if there's any more questions. But if not, I do have a final question for everyone. Just to kind of wrap it all up. What's something that you really value from your time at URI?
The people. I mean, I think that just keeps it short and sweet. You know, I in I guess hindsight's always 2020. I wasn't very involved in pharmacy clubs, in pharmacy life. You know, I knew my classmates, but I had, I made sure I was social in other aspects. Um, but coming back and during my first year of my 1 year residency, classmates, we were sharing, we've become closer friends after the fact because we shared this common bond of like, yeah, we got through pharmacy school during the same time, and now they're, inviting me to weddings, and we're close, and we're in fantasy football leagues together, and texting on the side. And although that relationship wasn't there then, wasn't as strong, I think it's only grown stronger because we're all, moving forward with our lives, and have shared this common, like we all did most of us did residency or fellowship. And I think the people is what makes URI so special, and also the faculty and staff. I know I wouldn't be where I am without them. And then I've got the chat open, so I will digress into what it says. Cope with time management when off of a shift before going on. I'm wondering so that I know how to handle with little downtime I will have later on. Um, Appreciate the downtime, and I think for me in managing downtime, um, it's I work to live. I don't live to work. I When I'm on vacation, I do not have messaging or emails on my phone from work. People know, my management's can text me, but I try to disconnect as much as I can. And I think that's the most important piece. I right now would be considered a workaholic. I'm still working per diem on weekends. I volunteer 3 times a month at a free clinic. I definitely have months where I overextend myself, and I know that. And I've set that boundary before. And so just understand when you're off, you're off. When you're on, you're on. And I think that's really important. And also, what Alyssa said earlier about, sports leagues or extracurriculars. If I have your hobby, people at work know I love to golf and surf. So where can you find Joe on a sunny day, either on the golf course or at the beach? And so, establishing that as part of your routine, I think is really important. Is to disconnect as much as possible before heading back in.
I would like to add that, so I'm the oldest one of this panel. I graduated in 2014, and I am still working on time management and disconnecting from work. I have regular conversations when I get called on an off shift, I always say I would rather you call me than let somebody die or have the wrong answer, and then bad things happen to a patient. 100% call me and bother me. But now that I have a kid, and I just kind of value my time away. And I think that there's a lot of pressure put on new grads, especially. I have a number of post PGY1s that just can't adjust as well to being in the residency realm, because I'm not going to lie to you guys, residency is you spend 100% of your time at the hospital. You pretty much live, eat, and breathe work. But after that, you have a tough time adjusting back to like normal life, and normal work-life balance. And people, want to put in 110%. And now that I'm still struggling with work-life balance. I just wish that those youngins, youths have better work-life balance and understanding that like it's okay if people don't want to contact you all the time. It's nice that you know, I've built a relationship where people want to contact me all the time, but it's, you know, it's okay to not have that happen. It's okay for other people to know the answers and not rely on you 100% of the time. And sometimes that's like whatever, a personality quirk, but I think it, you know, the type A personality that goes into pharmacy, I think is a lot of us, especially if we're trying, you know, to build our career outside of a traditional sense, or, you know, everybody feels like they have imposter syndrome 100% of the time, but really it's just, we need to learn, and there's no other way to learn than to do. You know, and I think that that's just, I guess that's advice that I would want to tell my former self as well.
And just to add on to that, if you know you're the type of person that can't resist looking at an email or something that comes in after hours, because now we have access to everything at our fingertips at every moment, just turn it off. Like, don't download those apps. Don't download Epic to your phone. Don't open that secure chat. Like, set those boundaries for yourself if you know that you're that type of person that can't resist.
Boundaries, boundaries, boundaries. I know we've been saying it a lot, but it's very important. And sometimes you learn the hard way, like myself. But I agree, like when I was when I was transitioning from, you know, being a student to my career, like I ended up in the inpatient setting within a year and a half after graduation. I never thought I would ever set foot in an ICU, and I had a lot to learn, and I felt like I was very hard on myself. But you just kind of roll with the punches, use your support system, especially in your team of, you know, mentors and pharmacists. And also, you know, today in my job, and you know, I'm not out of, you know, the woods for a long, like I haven't been graduated for a very long time now, but there are still things that I have never seen before. Constant lifelong learning is pharmacy. So, you know, don't be so hard on yourself when you're right out of the gates. We all have things to learn, and whether you're 1 year in or 20 years in, there's always going to be things to learn and things to adapt to. So just, you know, be kind to yourself, give yourself some grace as you navigate school and life afterwards.
Also, maybe don't give your cell phone number to patients.
Big
Like,
no, don't do
very
that.
good advice. Well, I think that's pretty much all the time we have. I'll see if we get any more questions in the next minute. But if not, I just want to thank all of our panelists so much for, again, sharing your time and knowledge with us. This has been really insightful. I feel like a lot of this advice is stuff I needed even right now, and I would have appreciated as a freshman as well. So thank you all so much. And thank you for all the participants who came today to view this panel. We really appreciate it. So hope you all have a good night, and thank you again.